Good morning, everyone. I'm Brian Ahier with OSP, and welcome to today's live webinar, AI in Healthcare from Hype Cycles to Care Cycles. And we're excited to have you all with us for this important conversation about how AI, robotics, and data-driven insights are transforming healthcare. At OSP, we're committed to advancing healthcare through technology, and today's discussion highlights practical strategies for moving AI from experimentation to execution. Before we dive in, I'd like to introduce our special guest today, Anish Kumar. He's a leader with extensive experience across large health systems, startups, and technology companies. Anish has been at the forefront of AI adoption in healthcare, guiding organizations on workflow integration and operational efficiency and patient-centric innovation. Anish, welcome, and thank you for joining us today.
It's great to be here, Brian. Hello, everyone. I'm excited about today's conversation. Uh, a
That's
little bit
great.
about me.
Yeah, please. Yeah, if you could start by introducing yourself, your background, and especially explain your work across large health systems, startups, and tech companies.
Absolutely. I've been in healthcare for 25 years. Through serendipity more than design, I've been privileged to traverse many parts. Started by building a COPD clinic, mostly serving Medicare patients, grew that and sold it to a hospital, and then at Accenture, served large healthcare systems as well as health insurance companies, more on the IT and operations sides. Give me a good idea of the bowels of the industry, if you will. Spent 10 years at large healthcare payers such as Aetna, Cigna, and Elevance Health, ultimately becoming the chief product officer at Elevance. In all these payer roles, though, I had quite a bit of health system joint venture and collaboration experience. At Aetna, for example, I worked with Innova Healthcare System to create one of the first ACO joint ventures called Innovation Health. At Elevance, worked with K Health, a digital health startup, about a text messaging based care that actually quickly became AI based text messaging based care. In the middle, I've also done a patient cost transparency startup that gave me a first hand look at the administrative and financial reality that small doctors and independent clinics go through. And then most recently, I was the chief product officer at Gainwell Technologies, which is the nation's largest Medicaid provider. And now I'm a senior advisor to McKinsey for healthcare and life sciences and bring my health systems, payer, digital health company background to some of the toughest problems in the industry. Delighted to be here.
Well, thank you very much. Yeah, you definitely have the experience and insight that we need for this webinar today. So you've seen healthcare organizations struggle with AI adoption. We
Yep.
all have. What's the single biggest misconception that leaders have about AI, and how does it differ across these three environments that we're talking about?
The
The
biggest
large health systems, the startups, and the tech companies. And I would include payers in that as well, because oftentimes it's the large health systems that are working hand in hand with the payers to try and move our healthcare system to more patient-centric and paying for value instead of volume.
Absolutely. Brian, the biggest misconception is that they can win on technology. Unless you are Google, Microsoft, Anthropic, focusing on LLMs, foundation models, MCP, and even very cool vendor tech, usually leads to the AI pilot purgatory that we are witnessing, where you start with euphoria, the business case does not happen, and then things fizzle out. In that context, I would say that, frankly, payers, which were the group you added, excuse me, have lagged a little bit, but I see a lot of clinical innovation on the clinical side. And then I'll come to health tech companies. Everything from the here and now problems, such as submitting claims better, ambient listening, to help with some of the patient experiences or sifting through very large data sets, whether they are imaging, uh, continuous glucose monitors, or other digital trackers. That is where, when you start with a business problem, you have a better hope of succeeding. On the health tech side, there's a wide variety. There are many, many venture and private equity funded companies that are taking a completely new look at healthcare. And of course, we are aware of, say, Open Evidence, which now has a multi-billion-dollar valuation based on its aggregation of clinical data for doctors. And they looked at a hard problem and then took AI to the problem. And on the other hand, there are uh, AI companies that are simply saying, I'm going to do what you do better. And they, I believe, are struggling because there are fundamental process problems in healthcare. Unless you address them, irrespective of which company you are, you're not going to get sustained benefit from AI.
Right. Well, I mean, I've seen tech companies, big tech companies like Google, Amazon, and others, trying to enter the healthcare industry and struggle because it's not just the technology, as you said, right? So they don't,
Uh,
Google's a great technology company, but it took a while for it to start to really understand healthcare. So Google Health, which launched years ago and then got shuttered. Microsoft Health Vault, Microsoft's another one, very involved in healthcare. All CIOs practically use Microsoft products in one way or another. And Microsoft understands the healthcare industry, but still struggled on the adoption curve. And so it's
uh,
not an easy entry. And then you've got startups, like you said, that are specifically geared towards healthcare that can even struggle in this industry. It's not necessarily just a technology problem.
Not even close. And the Google and Microsoft examples are apropos. They bring back memories. Even if you go to, say, Babylon Health, didn't they have a
Right.
$5-6 billion market cap before they went under? Right. So I think there
Yeah.
are, and of course, the original, the OG, in many cases before AI, was the original WebMD that Jim Clark
Yeah.
founded. And they
Yeah.
said, we're going to digitize the MD, the doctor that is, where everything will be connected. And they just did not understand or address the way money flows, the way decision rights exist in this industry, and the way licensure works. And eventually they transformed to something else. So I hope that with AI, companies do not make that mistake, partly because we have this learning, and partly because the stakes are much higher. AI
Well,
is a
and now you have
technology. Yeah, yeah,
Yeah, well, as I
absolutely.
say, now you have big companies still entering back in, right? The ones that came in, Microsoft and Google and Amazon, certainly making big plays in healthcare, but also the newer entrants, right? OpenAI now has uh, they're rolling it out slowly, but a healthcare tab where it's segregated and all the cybersecurity controls and privacy controls are in place to meet the HIPAA requirements. But it's a whole new world we're entering. I think we're going to have to talk again in another 6 months because things are moving so fast. It used to be a 2 or 3 year cycle, and now we're seeing rapid, rapid change and evolution. I mean, it's really remarkable the changes that we're seeing and how quickly they are. But
Let's
moving
speak a
on
little
now.
bit about
So,
OpenAI health before we're
oh
going to
yeah,
move
please,
on to
yes,
other.
please.
Yeah, because
Yep,
it's
I'd
such
love to
an
hear your thoughts on that.
intriguing topic. And then Claude for healthcare, which came out just
Right, that's the
4 days
other agent. Yep.
after after them, and then I was also listening to some very large health systems CIO, I will not name him, who said, if this takes off, we are done. I think that overstates the case. I don't believe that these two companies and similar efforts will take away um, care delivery itself, which is hyper
Yeah.
local and protected by licensure, but the cognition layer that comes before that, which is it's 2 a.m. Should I go to the ER, or is it just what I ate? Which surgeon should I pick? If these companies succeed in that layer, then the rest of care delivery will get commoditized. So my plea to the people on this call is that even though these companies are not going to deliver care, they are a major threat to the model itself. And because the model today really relies on significant information asymmetry between the patient and the doctor, that's going to go away. And even though AIs hallucinate, etc., at the end of the day, people will put their PHI voluntarily into these technologies. They will get good, bad, and other results, and they will use these results to make decisions because these technologies largely are free or token priced. So I think that's a major kind of right shift to the industry.
Yeah, it's a huge shift. And I mean,
Yeah,
I've been saying for years, people 10 years ago, AI was very nascent in people talking about healthcare, but I could see radiology where it was already having an impact even back then. And certainly now it's had a huge impact. But you know what? AI did not replace all the radiologists. What it did is it gave
not
them
at all.
superpowers. So,
Yes.
now a radiologist that doesn't use AI is really not any good. I hate to say, that you can't compete. And it'll be the same going forward with all the other specialties and even into primary care. It's not that it's going to replace doctors, it's going to give them superpowers so that a doctor using AI can see more patients and have better outcomes. And it's more efficient and even reduce provider burden. I think it needs to be more embraced in the industry instead of feared. And it's the same across all industries, not just in healthcare, right? Those people that right now are learning AI and how to incorporate it into their work are going to succeed. The people that won't succeed are the people that are sort of Luddites and ignoring the important advances in technology that we're seeing. So yeah, we're at the edge of a major shift in healthcare, and these big companies that are coming in recognize that, and of course are trying to monetize it some. But it's the products that they're coming out with. A lot of them are pretty neat. There's some pretty cool stuff that we've seen lately, and I expect that to just accelerate even more. So
Oh,
let's talk about what lessons about product excellence that you might have learned from Apple and payers that traditional health systems should adopt.
the first one is start with your core differentiation. Uh, the alpha, as I sometimes tell my clients, or why you deserve to exist. And it's a harder question to answer than most people believe, especially in a highly regulated profession like care delivery, where people say, I'm a doctor, I'm a pulmonologist, ain't that enough? It may not be enough in the coming years. Maybe you focus on stage 3 metastatic lung cancer. Maybe you focus on chronic diabetes management. So the first step is just that self reflection. And at Apple, for example, they took it to the next level in the sense that they thought of this differentiation in the context not of the industry that existed or the industries, whether it is publishing or the app industry, but the industry as it could exist. And that's an even harder analysis because it requires you to look at the value chain and how the value chain can be redefined, but the rewards are commensurate. But every healthcare organization, whether it is big or small, can do the first part, which is what am I good at that I need to become even better at? And how can I jettison the rest of the stuff, either by giving it to AI or giving it to other vendors? To build upon your earlier comments, Brian, I would say AI is not coming for your job, it is coming for your limitations. So today, everything you have in terms of how many images you can sift through, the pattern you can see, how quickly or efficiently you can diagnose rare diseases, a lot of that will become much more democratized. And that was the key lesson I learned uh, especially at Apple, that they democratized publishing, which was a guild, then, of course, video creation, and then through apps, access to the global information. Even at pairs, there are examples that we can learn from. For example, Elevance, when they founded Carelon, it originally had a different name. They really went out of their lane, so to speak. They said, Optum is succeeding with care delivery, with digital assets. And while this may create some friction with some network partners, my job is not to assuage, everybody I meet every day. It is more, bringing value to the industry. And now, how much it succeeds is beyond my competence to predict. But that is a good way of thinking about AI. And I'll maybe have a provocative thought here. Many care delivery systems are very reticent to either sell directly to consumers or even have any direct ongoing engagement separate from the patient visit. They're very reluctant to take risk on managing chronic conditions where most of
Right.
healthcare spending is done. We have to question all that. We have to question these things because you should assume that with AI, many of these hard problems will become easy, and then you should be a different company. I
Yeah.
think that's really the main lesson is that uh, a lot of the scarcity goes away with technology. And previous
Yep.
technologies have done that in successive ways. AI is all of that on steroids. So I think that it's a very exciting time.
Yeah. It is a very exciting time. So, looking at this year coming up now, 2026, I think this is sort of a hinge moment in history of technology, and it's meeting healthcare. And as you said, right, what one of the big needs is is to try and improve patient care, and AI can help do that. But also there's robotics, right? And so when I think about the burnout, nursing burnout. First off, I love nurses, and I think nurses are the backbone of our healthcare industry.
Yep.
Unfortunately, our healthcare industry has a terrible backache. And the nurses are older and more close to retirement. We're having it's just the aging of our society, really, but especially in the nursing area. And so we have a terrible shortage of nurses right now, and you can see that they're bearing the brunt of this a lot on their own. So when I look at 2026 and robotics moving beyond the operating room, right? It's moving into other areas in healthcare. Where do you see the most undervalued opportunity to solve nursing shortages without adding workflow screens?
Nursing assistants, perhaps that's the best way to describe it, which is not
Yeah,
replacing nurses, but augmenting them by doing uh, more basic tasks so that they have higher bandwidth or they can do higher order pattern recognition. It's already here and now. Uh, and
yeah,
I think that will grow. It can start with basic things like reminding at home patients about taking medicines, asking basic questions about well being, whether they have suicidal ideation, triaging to a human nurse or even a physician as appropriate. I think that is an area where the technology is good enough to serve in 2026. Again, it will not become these AI nurse robots that you sometimes see in science fiction movies. That's a
yeah.
long, long time away. But just this assistance to nurses is amazing. One other aspect of nursing that we should speak about is that shift nurses have a brutal schedule, right? 2 a.m. on Sunday, that type of stuff. So, is there a way to potentially leverage in hospital robots in this case, because it is a more constrained, safe environment, to again require fewer nurses to leave their homes at an ungodly hour. And there are some startups working in that. But digital nursing assistants can be the eyes and ears of nurses remotely, and they can do things where the stakes of making a major mistake are small, and when they go beyond a certain threshold, they can invoke human expertise. So that is going to be an increasing thing, and many people on this call may already have seen robots in restaurants. They bring you
Mhm.
your food and do other things that do not have that much of a risk. What will they do? At most, go to the wrong table, right? But I think nursing will take the same route. There is a very significant shortage. One thing I would add is nursing salaries have gone up significantly, and the shortage persists because there are only so many nurses and so many good nurses.
Right.
We have a serious problem in society, especially with the aging of people. So this will be the year of
Yeah.
AI nurse or robotic nursing assistants.
Assistance, right. Yeah, not to replace
Yes,
the nurse, but to ease the
not at
burden,
all.
right? So, nurses often walk several miles every shift they work,
Yes,
up to a half marathon's worth of running around, just fetching
correct.
supplies and medications and lab specimens. And especially in the hospital setting, where I'm already
Yep,
starting to see this being used. A nursing assistant, robotic nursing assistant could help offload some of those tasks from nurses. Um, you know, it- the robots software that doesn't require hands-on keyboards can operate autonomously in the background. They can open
absolutely.
elevators, use secure doors, navigate hospital halls, and deliver items directly to the nurse's station. So
Yep.
that's going to be a benefit to the nurses to not have to uh, wear out their shoes as much, but also the physical assistance. And I think about long-term care facilities and skilled nursing facilities where strenuous tasks like lifting and transferring patients, which is where a lot of sometimes, someone's back gets injured when they're transferring a patient, you could safely have robotic assistants helping with those strenuous tasks like that. The other thing I was thinking as part of this question was about the need to avoid the workflow screens, right? So sort of self-sustaining robotic systems that function as part of the hospital's infrastructure rather than being
Mhm.
a separate tool to be managed, right? So that sort of integration as infrastructure. I wonder if you could talk about that at all.
Oh,
Because I know before
absolutely.
you go,
One
I
point.
just want to say I read a lot of your stuff from McKinsey Health Institute. And one of
Oh,
the
thank you.
studies that just came out talked about the supply of nurses being critical, but it's only half the solution. And
Absolutely.
so redesigning care delivery through robotics could help to retain, it's not going to replace the healthcare workers. It could help retain the millions of healthcare workers by reducing all these mundane tasks. Sorry for interrupting. Go ahead.
Absolutely. A couple of thoughts there. I mean, through a client that I cannot name, we did a study of the things that nursing assistants or nurses, physical assistant, and medical assistants are asked to do when a patient rings that bell in a hospital or ICU setting. And a number of those tasks are relatively uh, routine. I want water, or the light is too bright, or can you turn the TV on, or the room is hot, those types of things, or can the Murphy bed go up or down. These types of low risk things, if that walking, the moving away from station can be taken away, it will be fantastic. But you mentioned integration. I mean, that's the key where you do not want this new technology to run in a chaotic manner any more than a hospital already runs, because people are running around, doctors are running into nurses, that type of stuff. EMRs, EHRs, were supposed to address this problem. I would say that their performance leaves something to be desired,
Often.
because they're more focused on billing, etc. But I think that's an undervalued opportunity, which is how do you run a health system with human and digital workers? And the phrase I use is digital worker as opposed to a tool, because as the months and quarters go by, this technology will become more autonomous, will get more decisions within its purview, and will have elements of sentience. So, with that combination, you have to think of workforce management with these types of workers. Now, you could say that human workers have greater capability. That's fine, at least for a few years. But even if we have more capabilities, you could say, I have human nurses, I have digital nurses. Digital nurses work under the supervision of human nurses, and this is the ratio. What is the ratio? We don't even know. So those types of
Right.
things is really the integration, and then the software comes in to execute it.
Yeah. Well, and you bring up a good point, especially when we think about agents, right? And that can become coworkers actually. And
Yeah.
I've seen some really interesting, just recently, some really interesting things, that people have been able to do using Claude, using OpenAI, and using Grok, and Gemini as well. So, those are sort of the
Yes.
four that I've seen really starting to make an impact. And beyond just chatbots and large language models, the LLMs, but so how should CIOs evaluate AI agents that can autonomously schedule tests, triage patients, or even manage care?
Whether the CIO is evaluating a vendor or an internal team, ask them hard questions. And I find that most CIOs shy away from hard questions, such as how will this solution work for this specific patient subtype? And that's where the team or the tool or the vendor's knowledge of what you are about comes to fore. If they are very generic, then it's likely that they are not going to succeed. What is the specific trigger to transfer to a human being? How do you determine that? What's that trigger? How will you automate the protocol, not the data entry, not the analytics? Data entry and analytics are IT functions. And of course, it's good that they are getting automated or have been automated. But automating, well, first creating, defining, and then automating a clinical protocol is much harder. In fact, many systems don't even have a good documentation. But then once you start to automate that, you run into very hard problems. So these types of questions will give the CIO a very good sense of whether the team has thought deeply about the problem to be solved. And chatbots are a great example. All of us remember at least the early versions that were very frustrating. They did not provide any real information. They frequently went into infinite loops. And even after you said no to something, they came back and asked you the same question. Now, the generation that is now coming in, really from the larger hyperscalers, is much more natural. It actually feels a little bit like a human being compared to the chatbots. And I believe the same should happen to these agents, which is rather than the human being or the patient fitting into the agent's structure, the agent has to respond in real time to the patient's needs, moods, and clinical needs. And I think some of these hard questions will give you the look behind the curtain, so to speak. So the answer is not to say no. In fact, the answer is to say yes and also make the team better by forcing them to think deeply. I think that's where the fun will be. And good CIOs do that already.
Yeah, yeah. And of course, they've got to move beyond accuracy to reliability and safety. So it's one thing for hallucinations or sort of, inaccurate things to come out from the AI agent, but in healthcare, we've got to have safety and reliability and integration. So,
Yes,
if you have an agent that's doing scheduling, booking appointments, or tests, it has to have read-write access into the EHR. And a lot of the EHR companies are starting to build these tools in. At least, I know Epic and Cerner or Oracle um, are
absolutely.
starting to do this. And we're going to see Meditech and many other hospital information systems fall in there as well. They'll all start to be looking at this, and you have to have the integration in place to make that happen. Um,
I agree. I agree. And that's a great caution point for health tech companies. When Epic announced their ambient AI, 30 to 50 ambient AI startups did not have a reason to exist anymore. Now, some of them probably had better technology than Epic, but the value of platform integration is so high that once somebody like Epic or Oracle announces something, you have to then shift, work in the nooks and crannies, or be able to work independent of the EMR, which is its own,
yeah, very
its own
difficult.
problem. Yep, yep, absolutely, absolutely. That is true. And you brought up the whole issue about reliability, and that spurs a thought, Brian, about data quality.
All right. Well, that
And
was my next question to you,
oh,
right? So, what's the minimum viable data quality that's
oh my
needed so we can
God.
move AI from the lab experiments to live care cycles? And you brought up ambient AI, and that's a great example. And I would point to Kaiser Permanente that from 2023 to 2025 had a pilot going
Yes.
for ambient AI and charting assistance. And now they've gone wide, enterprise wide, and implementing it live for care across all
But
24,000 plus care providers and all of their hospitals. It's pretty incredible, and I imagine that very soon we're going to see the Veterans Administration, which is a very large integrated delivery network in a sense, um, move along the same way. But data quality. What's the data quality that's needed so we can move AI from these lab experiments into live care cycles?
you bring up a great point, Brian. For 30 years at least, healthcare companies, including health systems, have used technology without doing the hard, non-glamorous work of normalizing and cleaning data. Do you have a single record for every patient? Can you compare lab tests of different origins? If you cannot, AI will simply be a vanity project and it will only add to the turmoil and the chaos because AI operates at a much higher speed than previous
Right.
technology. So you
Yeah,
have
if
to
you're going in the
actually,
right direction, AI will accelerate you in the right direction. That's great. If you're going in the wrong direction, AI will accelerate you in the wrong direction as well.
absolutely, you'll get into a ditch that much faster, right? You'll have a data breach that much faster, etc. So one of the things when I was speaking about your differentiation, the core of that is it comes to life in terms of workflows, processes, or protocols, different terms, but similar sentiment, and they depend on data integrity. So you cannot have a good process for anything unless you have normalized, connected, current data that you can rely on. It doesn't live in a silo. And some of that can be done by AI. There are AI tools that cleanse billions of records, etc. But most of it is really hard thinking around data models, data validation, something as simple as first name, last name, phone number, email address of a patient. You take that in, but you never validate it through a primary source. It's going to stay in your system like a virus. And are you Jimmy? Are you James? Are you John? That type of stuff. You go by something else, Jack,
Well,
entirely.
George Foreman, and you have five kids and you name them all George Foreman.
Or that's right.
Um,
So I
so
think
which George Foreman are we talking about?
so yeah. What's the kind of unique identifier there, and the list goes on. I mean, lab tests are a great example of what are the units, and so on and so forth. Is it by mole? Is it by deciliter? Uh, and there are some standards like SNOMED that can help with that. But all of that is that data quality is a precursor to good AI. And that's where I think the CIO has a huge role to play. They may not want this role, but that's the area where if you put the right investment and you get on the right track, so to speak, the rewards will be amazing. Because then everything you build will be done on the right chassis, and AI can then just bring the speed to you. So I would say
Right.
that would be one of my please. And the other thing is, if the organization does not have this capability inside, because it consists of nurses and doctors and surgeons, or it consists of payer actuaries, etc. There are many vendors, uh, some based offshore, some based in India, who will do that because it's a very horizontal skill set. Once you guide them, they can be human AI, as it were, and then once that human AI brings you to a certain level of quality, you are good to go.
Yeah. You gotta have the quality comes first, though. Garbage in,
Yeah,
garbage out, right? I want to pivot back though to ambient AI, right? Because tools that add even 30 seconds to a clinician's workflow fail. So, and we've all been to see our physician or healthcare provider, and they have a laptop. We've done a great job in the last 10 years at largely at digitizing our health information. So that's great. Everyone has now an electronic medical record, and there's a lot of capabilities that that brings to bear. But it also sometimes creates documentation nightmares
oh my
for the
God.
clinician as they're trying to have I remember a friend of mine, pediatrician, um, said that, one of the things that really impacted her was when, sometimes the kiddos would draw pictures for her, right? And they'd give them to her. And so one time the little girl drew a picture of her, um, and it was the doctor and with just the eyes peeking over a laptop. And that was
Ooh.
the picture of her. And she thought, that's how my patient sees me, peeking out from a laptop occasionally, because I'm so involved in documenting and working with the EMR. And you've got, 7 minutes for a visit, and then you're on to the next one and on to the next one. And then afterwards, you've got to go back now and do all your paperwork, all in the EMR. So sometimes clinicians have complained about EMRs because they actually can get in between them and their patients. And this is where ambient AI, I think, can help so that doctors can spend more time with patients and less on the screens. But how do you design ambient AI so that it's effective and can help the clinicians?
First, I would say that when you say sometimes clinicians complain, you are being very
I'm
charitable.
being generous, yeah.
Very few clinicians have ever expressed love for any of the major EMR systems. On the ambient side, I'm very hopeful, in fact, because because we are comparing this technology to the EMR, where the doctor has to pick from 25 drop downs and this CPT code, and that puts your back to the patient, or puts your face behind the laptop. If you look at non-healthcare note takers, even Granola, and there are 25 companies like those. Just in the last 6 months, they have become really good at first understanding what was said at the very minimum, and second, drawing out patterns of next steps, action items, and other characterizations. Therefore, if I were designing an ambient AI, I would start with a foundation such as that. And then what you have to bring in is the clinical context. The clinical context significantly narrows the number of word phrases and intellectual constructs that could be happening. And that this goes back to my earlier comment where many of the best AI tools will be specific to the patient subtype or the disease class or the care delivery specialty. Because imagine the power you would get with ambient AI that was specifically designed for cardiology and cardiac surgery. It is going to be extremely insightful. And then you could have a different one for for neurology, for example. Now, over time, there will be a roll up, and people will buy other companies, etc. But you have to start with the clinical knowledge, the phraseology. No doctor ever calls a heart attack a heart attack. They will say myocardial infarction. And instead of a stroke, they're going to say an ischemic attack and so on and so forth. So you have to know at least those terms. And of course, they may sometimes say stroke too. So the vocabulary and the overall kind of clinical seriousness that has to be built in. And the consumer tools today do not have that. And that's the reason that healthcare ambient AI and even within healthcare, or potentially a specific healthcare AI, has a place to be. And I'm very excited. I think this could really be a good assistant and freer for physicians.
Yeah, I
Yeah,
think so too. I'm very
yeah,
excited about, especially as I see it now going into reality, into practice. Um, it's a very exciting time. So
yeah,
let's talk about autonomous healthcare pods, right? This has kind of shifted from science fiction to really a functional extension of the whole medical ecosystem. And it can address sort of the exam room accessibility gap, right? So thinking about that, um, how close are autonomous pods or mobile IA-enabled units to becoming fully functional exam rooms, even in patient driveways?
yeah. I believe that full autonomy, a little bit kind of comparable to, say, Waymo on the car side, is still is quite a bit out because of all kinds of liability. But to our earlier discussion, they can be a massive force multiplier in terms of the productivity of a med tech or
Right.
potentially getting human clinicians that are mid-level as opposed to deeply trained and making their visit smaller. So there's some supervision. I have started to see some of these pods that have human supervision, but it is not proximate. It's not in the driveway. It is in a central location over the internet, and that is another way that it will look completely autonomous, but there's somebody watching. That will probably happen in 2026 when you can imagine say a rural setting, say take a state like New Mexico, where most specialists are concentrated in Albuquerque, but the state is vast. You could have some of these with remote human supervision, and then over perhaps 2 or 3 years, they become fully autonomous, at least for a range of use cases. So it's not quite there yet, but the access problem is real. And
Yeah.
and also when you a little bit on the healthcare side, when you enter someone's home, you observe more than you would in a
Yeah.
clinical room. You see alcohol bottles, you see the food they ate, you see the whole person. Uh, and if these technologies can also detect the pattern of what that could mean, that will be awesome.
Yeah, I think this is a great opportunity in rural
Yes,
health, right? As we're looking at in
yes,
rural health transformation in this country, and each state is thinking about how can we address some of the issues that are specific to what you just mentioned, the New Mexico example. But really, in every state, there's these
correct.
deserts of care where high definition telepresence link connecting a patient to a human specialist who reviews
Yep.
the real-time data that's streaming in could be incredibly valuable. I know that right now there are already devices on the market for autonomous phlebotomy, right? They use ultrasound and AI to autonomously locate the veins and perform the blood draws without any human intervention. Um, and there's some of the blood draws that I've had, that sounds like that might be a pretty good idea to me.
Yeah,
But
I'm in fact advising a stealth mode cannulation company that does the same using an iPad and some AI. It figures out the best venopuncture site, which especially for elderly patients can be a challenge. So yeah, in very specific use cases, it's happening right now. Yep.
So let's move into this whole idea of connected wearables, right? Um, there's an explosion of data from wearables and home monitoring devices, and clinicians are really facing this tidal wave of data, a tsunami of data that's pouring in. And we need to filter all these billions of data points into actionable insights so that we're actually helping doctors rather than just adding to their alert fatigue. And so, as this home generated health data becomes more clinically sophisticated, it's really threatening to overwhelm not just our clinicians, but our EHRs and their capabilities to integrate it into the systems. How can health systems build a filter that ensures that only the most critical, life-saving notifications reach the clinician at the right time?
Yeah, this is a hard problem. Let's remind ourselves that it has existed for more than a decade. I remember Validic's original launch and then human API, and there have been a number of attempts. And in fact, physicians are very frustrated because patients come in saying, I have all this data, and it's just hard to make uh, anything of it. Uh, but again, AI is going to address, in fact, it is already addressing this problem. I mean, you can connect some of your tracker data to some of the OpenAI stuff, and companies like Apple and Google, which acquired Fitbit, now are building infrastructure that can do some of that themselves. I even saw this startup in Austin that does the same for testing. So as more and more people wear these things that track their sleep, blood pressure, etc., some of that is happening from the device platform itself, which is it takes billions of data points and just spikes out what it believes are anomalies or things that are worth looking into. It will be hard for most healthcare systems, and I'm excluding this, Stanford, Mayo Clinic level people, but if you exclude the top five, this is a very capital intensive uh, software effort, and you'll need to monetize it across or amortize it across a very, very large patient population. So this is an area where the health system will have to work either with some of the large device platforms, with the Dexcoms and Googles and Apples, etc., or EMRs. Now, the EHR track record for solving this problem has been very poor, I must say. So I'm not quite sure that they will address it. But also, EHRs are ecosystems, meaning that every major EHR has hundreds, if not thousands, of partners. And I can see this as a specialized partner that plugs into your Epic App Orchard or Athena, more disruption, please, kind of ecosystem. And that way you are connected to the EMR, kind of the work record, so to speak, and you are getting only the spiked out results. And there will be trial and error. There is really no good marker for how what to call out today. It just lives in doctors' heads. Uh, but I'm very hopeful that with AI and especially with the investment a company like Apple, Google, OpenAI, Anthropic, or Amazon can put in, we will get to this consumer level, really physician level. Uh, data filter, and then if they want, they can go deeper. I think that should be the model. They get the news, they're a little curious, they can double click.
Yep.
Yeah.
So we're just about out of time, and I've got a couple of important things I want to cover. First off, looking like a 5-year time horizon, what fundamentally separates AI integrated health systems that thrive and are successful from those that fail, even if they've spent very heavily on pilots?
Three things come to mind, Brian, and everybody on the call. One is, as I've said a couple of times, connect a connection to your differentiation, your alpha, your why. And too often, all companies, including health systems, do not do an honest and deep job on what they are good at and what they should not do. The second is this area of codifying your knowledge and processes. You cannot improve what you cannot measure. Today, a lot of the information about clinical excellence lives in doctors' heads. All the specialists at Johns Hopkins and Mayo Clinic and the Cleveland Clinic, etc. And that's all good. But let us realize that AI can read medical papers and learn new things thousands, if not hundreds of thousands of times faster than any human clinician from anywhere. So we have to start by saying, in terms of my differentiation, where can I bottle knowledge, learning, and patterns that grows irrespective of one clinician? So that will be the second attribute of people who win. And the Cleveland Clinic has done some amazing work for cardiac care, based on this. And that's not even AI. That's just supply chain and other things. And lastly, openness to new ways of doing things. Uh, Care delivery is a highly regulated and licensed profession or set of professions. And that is good. It protects the industry. But I believe that that protection is going to uh, become much smaller with AI, robotics, quantum computing level processing power, etc. So while it is good to have that licensure, after all, civil engineers are licensed too, architects are licensed too. There are dozens of licensed professions. It is worth not falling back on that every time, saying, I can do that, a nurse practitioner can do that. What could be a new way of doing things? And when you are open to that, you'll find that there is tremendous waste in our healthcare system. Administrative waste, unnecessary care, multiplicity of tests, all kinds of BS. You don't even need AI to fix this. You just need an openness to try new things. And uh, once you have that intellectual honesty, you can then use AI in the way it should be used, which is to enhance your differentiation, your domain knowledge, your clinical expertise.
Thank you. Yeah, so I have one more question, but before I get to that, I hadn't been looking at the chat. Okay, so there's nothing in the chat right now. And
Okay.
so I just want to encourage people, if they have questions, to go ahead and enter them in the chat so that we can address those, we can talk about those, but also, we can always follow up afterwards because just in the interest of
Of
time, I
course.
don't think that we're going to be able to do everything that we want to do here. But so for my last question, right, imagine a healthcare leader has a board meeting tomorrow. What's the
Ooh.
one disciplined step that the leader needs to take to convert AI vision into a tangible Q1 execution?
Start with a business question and keep an open mind. So ask the question, what if? What if my surgery patients could live without ICU level care? What's stopping this? How could I enable that with AI? How could I pay so that I make more money when people are not in an ICU than when they are in an ICU? That's an example. You start with that, and that is going to naturally focus you to business problems and business opportunities. And then you could say, then as you go deeper in your prep for the board meeting, you'll realize that there are many dead ends, many questions that sounded interesting but did not pass muster after 15 minutes of analysis. Others not only stay, they keep on coming back. And that then can lead to, what if this magical technology was available to us to solve some of the hard compute and pattern recognition problems? And from that, you can create a lightweight business case. In a first conversation, the board is not going to look for very precise return on invested capital type numbers. They want clear thinking. So that clarity of thought is the discipline.
Thank you. That's great. So I guess the chat is actually disabled. So you'll have to use the Q&A panel. A couple people
Ooh.
have clicked on the Q&A and said chat's disabled. And so the first question someone's asking right now is, Anish, is it okay if we share your email so that people can connect with you
Oh,
or at least your LinkedIn profile?
oh, my email is fine too. I mean, my LinkedIn profile, of course, is publicly available. It's also easy to remember and tells you a little bit about how I think. It's linkedin.com/in/AK disruptor. AK are my initials, and I chose the disruptor moniker, 20 years ago when it was not even a cool thing. Uh, my email address I can type here is my first name 060 at gmail.com. Um, LinkedIn.in. Okay, webinar chat. So I hope that answers those two questions.
Now, when in that chat, I put your LinkedIn in the answer to the I don't know if everyone can see the chat. I said it
Yeah,
to,
I mean, it says
yeah, you
hosts
just
and
sent that. It
panelists.
says
I'm
you
not
sent that to hosts and panelists. You got to change the little two button down there to
everyone. Can I put that in Q&A then? Ah, actually, I see something
change it to
from.
everyone. Yeah. So there, I put it
So
in the
first, let me.
everyone. But let's look at this next question here. I see you're typing an answer in, but the question here is, well, now you answered that question, but we didn't really address it. What is the
No, no, no. I,
biggest
I actually just put
challenge
yeah.
that we have as AI adoption? What of the biggest challenges that we have had is AI adoption in the medtech space, medtech? What tools or techniques have you used to help others embrace AI?
Yeah. The biggest challenge has been the interplay of AI with federal approval, FDA approval or related approval, because those approvals have a very rigid and pre-AI, perspective. The way a molecule gets approved with, phase one, phase two, phase three trials, and so forth, and and even medtech devices. So I think that's been a little bit of a disappointment slash frustration for some of the companies that I have worked with. Fortunately, some of the newer AI tools as well as processes are more cognizant of how the approval process works, how CROs work, for example, and how you can go from digital trials to mouse species and so forth. So that is where the challenge will get solved. But because it's a highly regulated space, that's been challenging for AI or even related technologies like machine learning. But I now see that most of the advances, a lot of advances are in medtech because you can try all kinds of protein folding, for example, much more efficiently than you could even 6 months ago.
Yeah, so unfortunately, David has to leave before we could answer his question. He put a question in about the top five AI books on his list. I don't know if you see that question there in the Q&A. And that's
I,
a great list of books there. The only thing I would add to that is The Coming Wave by Mustafa
Yes.
Suleyman, which is a fantastic book. I encourage everyone to read that one because it's a real eye opener. But that is a good
That was
list
my
of books.
first book in this area, and actually it goes beyond AI, as both of us would know. It includes
Yeah.
robotics, quantum computing, nuclear fusion, and cell level engineering. But
Well, and it
it is
gives
a
a great
classic.
historical perspective too to look at how we addressed issues of nuclear weapons, right? So if
Yes,
AI is an existential threat, how are we addressing that technology, similar to how we address the technology of nuclear weapons? Okay,
yes.
so I see we have one last question. We see opportunity everywhere in the health tech space for improving and streamlining things with AI. What are some key areas and pain points that are ripe opportunities for AI?
I believe we addressed uh, a few of those at the very least. I mean, nursing assistance is a here and now problem. We also spoke about uh, data cleansing and pattern recognition from existing data so that you're ready for AI based enhancement. A little bit of a detour into how, with remote human supervision, you can have greater access in rural areas, especially. And uh, Lastly, it would be now this one is a little more capital intensive, but making sense of the billions, tens of billions of data points coming from trackers and other connected devices. But I think I know that this place is ripe with opportunity. It is ripe. Start with your business advantage, focus, mojo, alpha, sweet spot, because that's what makes us human. And we have to live and thrive as human beings in a future that will also have digital species.
That's right. Well, that's a great place to end. It's an exciting and a little bit scary place to end there.
Yep,
But it's true. So I just want to thank you, Anish, so much for spending your time with us today and sharing these insights with us. And I think this has been a great conversation. And so just as we wrap up now, do you have any closing comments you want to make before we end?
yes, a couple. First, thank you, Brian, as well as everybody who spent time on this. I appreciate that. It was a delightful conversation. And I will say that this is a field where nobody has all the answers. So, applying the first principles of success, contribution, and business high performance will remain. Uh, and then using AI as a force multiplier, something that takes away your limitations, is the way to go. So the story is being written. We are at the very beginning of it, and there are exciting times ahead. On a tactical basis, you can always contact me by email if you want to bounce some ideas off me, or I can help you in any way. Thank you.
All right. Thank you very much. And thank you everyone for attending. We really appreciate it. And we'll look forward to seeing you again at our next webinar. Have a great day.
Absolutely. Thanks much. Bye.